Hi, my name is Glen Crum, and I'm going to do a health history for advanced physical assessment class at the Robert B. Miller College. And this is Shannon, and she will be playing the part of the client, the patient, and um, again, this is the health history assessment. Um, so, hi, I'm Glen.
Hi.
I'm going to be your provider today.
Okay.
I'll be doing your health history assessment. Can you tell me your date of birth?
1/24/1980.
Okay. Is it okay if I call you Shannon?
Sure.
Alright. Good. And this should take about, 20 to 30 minutes.
Okay.
Alright. Can you tell me what brings you in here today?
I'm having an IBS flare-up.
Okay. And how long has that been going on?
The current flare-up has been going on for about 2 weeks, but the IBS has been going on for about 10 years.
Okay, since about 2002?
Mm-hmm.
Okay. And can you tell me, is it your abdomen, your belly that's having problems? Can you tell me what part of your belly?
All over.
All over?
Mm-hmm.
Okay. And would you consider yourself to be having pain?
Yes.
And how would you describe the pain? Would it be burning, sharp, dull, aching, gnawing, throbbing, shooting pain?
Very crampy and achy with some occasional sharp pain.
With occasional sharp pain.
Mm-hmm.
Okay, so cramping and achy with occasional sharp pain.
Yes.
If you had to put it on a pain scale of 0 to 10, 0 being no pain and 10 being the absolute worst pain you've ever had, can you put it on a scale of 1 to 10?
I'd say it's a pretty constant 6.
A 6 out of 10? Okay. You can tell me what makes it get better? Any kind of rest, medications, positioning, anything you eat makes it better?
Nothing really, that's the problem right now.
Okay. Can you tell me what makes it worse?
Eating.
Eating, okay.
Makes it worse. Any kind of pressure to my stomach at all.
Okay, so eating and touching.
Mm-hmm.
Do you have any family history of IBS?
My mother was diagnosed right around the same time I was.
So in 2002 also?
Mm-hmm.
Okay. Is there anything associated with the pain, the abdominal pain, that goes along with it?
Heartburn.
Heartburn?
Mm-hmm.
Okay. Is that severe heartburn?
Yes.
And is it come and go, or is it constant?
It's constant.
Okay. And is there anything that you can't do now that you normally would be able to do related to the flare-up of that IBS?
Just really anything physical.
Like physical activity?
Mm-hmm.
Okay. So it's difficult now, it's a taxing effort to do it now?
It is.
Okay. Whereas normally it wouldn't be an issue?
Right.
Okay. So let's talk about your current health.
Okay.
How would you classify your health, aside from the IBS right now?
Still very healthy.
Okay. So you consider yourself to be healthy other than the flare-ups?
Right.
Do you have them very often?
They come and go.
Okay. So can you tell me who you think is responsible for your health? Like, am I responsible for your health? Is your mother?
Myself.
Okay. Do you have any cultural things that are relevant about your perceptions to health?
No.
Like, are you, what would you say your like ethnic background is?
Caucasian.
Okay. No specific European ancestry or
No.
any beliefs that go along with that?
No.
Okay. So can you tell me what your expectations are?
Just hoping to be able to alleviate the heartburn and the pain, so just kind of get back to my normal everyday routine.
Daily activities. Okay. Let's talk about your health, your past health.
Okay.
Like as a child, did you have any measles?
No.
Mumps?
No.
Rubella?
No.
Chickenpox?
Yes.
Do you know about when you had that?
87?
1987, so you were about 6 or 5, 7?
About 7.
Okay.
Mm-hmm.
Pertussis or whooping cough?
No.
Strep throat?
Frequently as a child, less frequently as I got older.
Okay, so recurring?
Yes, in earlier childhood.
Okay. Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Okay. Any adult illnesses besides the irritable bowel?
No, that's it.
No? Okay. Have you ever had any injuries, accidents, fractures, broken bones, nothing like that? Oh, you're blessed. Okay. Any hospitalizations?
I've been in the ER a few different times for the IBS and then for just for the procedures that go along with that, but never admitted.
Okay. So you've just been at ER visits. You can take a drink. It's okay. Have you had any procedures
Colonoscopies and upper scopes.
at the same time? How many times have you had that?
3.
3 times?
Mm-hmm.
Okay. All upper and lower?
Yes.
Okay. Do you remember about when that was?
The first one was 2002.
Okay.
And then the other 2 were done in 2010.
Okay. That was a rough year then.
It was.
Okay. Do you know who your doctor was that?
I don't recall.
Okay. Do you know where you had them at?
The first one in 2002 was done in Kalamazoo.
Okay.
And the second 2, Oak Lawn and University of Michigan.
Okay. You know where you had it done in Kalamazoo?
Borges.
Okay. Did they notice any significant findings from your colonoscopies? Or from your upper GI? Just
looked like everything was normal.
Okay. Do you have children?
I do.
Okay. And how many?
2.
What are their ages?
5 and 6.
Okay. Boy and a girl?
Mm-hmm.
Good combo. So you've been pregnant twice?
I have.
Okay. And you've never had any miscarriages or abortions
No.
or anything like that? Okay. And were they a normal course of pregnancy?
Mm-hmm.
Okay. No gestational diabetes
No.
or excessive morning sickness?
No.
Anything like that? Okay. Just curious, did your nausea, did you have IBS flare-ups while you were pregnant?
No, the IBS was fantastic during both the pregnancies.
Okay. So the hormones were, you took to them well?
I did.
Okay.
Mm-hmm.
Are you up to date on your immunizations?
No.
Okay. Did you get immunized as a child?
Up until about the age of 12.
Okay, what was the reasoning for stopping?
I was sick a lot as a child. I had some autoimmune issues, and so
What was the autoimmune issues?
Epstein-Barr and chronic fatigue.
Okay.
And so it was discussed with the doctor and my parents that it would be beneficial for me to not have the shock at that time.
Okay. You've never not been excessively having problems with cold and flu?
No.
Okay. Do you have any, do you immunize your children by chance?
No.
Okay. But just always make sure you talk to be upfront and have frank discussions with your pediatrician and make sure that, all options are discussed.
Absolutely.
And, follow all the procedures with the schools, all that business. Now, do you have any allergies or reactions to different types of medications?
I'm medication sensitive, but not allergic to anything.
Okay, so like you react to small doses even?
I do.
Okay.
Mm-hmm.
Any foods?
Lactose intolerance.
Oh, okay. Is that related to the IBS kind of, or?
It seems to be.
Okay. Have you always been lactose intolerant?
It developed as I got older.
Okay. Any issues with any other foods?
No.
What about dust or molds, things you would inhale?
Not to my knowledge.
Okay. Anything physical, latex?
No,
Nothing that you touch, have a reaction to? You ever had allergy testing?
I have.
What did that show?
We said everything was normal.
Okay. So no reactions.
No.
Now, do you take any medications?
I do.
Did you bring them with you?
I did.
Okay.
I take a multivitamin.
Okay. You take that once a day?
I do.
Okay.
And I take a calcium supplement once a day.
Okay.
And I take Prilosec twice a day for the heartburn.
Okay. Does that help?
It seems to.
Do you know what Prilosec is?
Mm-hmm.
It's a proton pump inhibitor, so it keeps the stomach from making excessive acid.
Right. And I take a vitamin B.
Okay. You take a vitamin B12, I see. Okay.
Mm-hmm.
You take that daily?
I do.
And what for?
Extra energy and due to being vegetarian.
Oh, okay. I see it's a B12 supplement. You might want to take a vitamin B complex.
Okay, would that work better?
Yeah, that would be a little bit more to cover you in case you weren't getting all the B vitamins in your diet.
Okay.
Okay. Now, you don't take anything for the nausea?
I've been prescribed some Ultram for pain and some different nausea medicines just to keep on hand to take as needed, but I found they don't work
So you don't
all that
really
well
take
for me,
them?
so I don't take them.
Do you know what the names of any of them besides Ultram? Oh, you brought those two.
I did.
Okay, so promethazine and Zofran?
I do.
And
Mm-hmm.
Ventol?
I don't have the Ventol. I've been on the Ventol, but it
Okay.
didn't work for me very well amongst other
So
ones I've been on.
none of them have been effective.
They don't seem to be.
Okay. And you do take all the other ones every day?
I do. These are just in case for an extreme flare-up.
Okay. Now, if you did have you taken them during this flare-up?
I haven't during this flare-up. The nausea hasn't been quite as bad.
So, okay. Now let's see here. Let's talk a little bit about your family history.
Mm-hmm.
And this would be like your parents, your grandparents, your siblings, and your children.
Okay.
Do you have any history of heart disease?
My grandfather passed away from congestive heart failure.
And how was it your mom's?
It was my mom's father.
And how old was he?
I'd say when he was diagnosed or when he passed away?
Both.
I'd say probably late 70s, and he passed away in his 80s.
Okay. Any history of high blood pressure?
My father's side, like all of my father's side.
Have hypertension?
Mm-hmm.
Okay. At what age do they usually have
Probably 40s, 50s.
40s and 50s, okay. Any history of strokes?
My father's mother had numerous strokes.
Okay, do you know what age?
And she was in her early 70s.
Okay, did she pass from? Is she still?
No, she passed.
Okay.
She passed.
History of diabetes?
My mother's father had diabetes.
Okay. Do you know if she had type 1 diabetes or if he had type 1 diabetes or type 2? Like, did he have diabetes from childhood or did it happen later?
No, it developed later.
Okay. Do you know what age about?
Probably late 70s.
Okay. What about any history of blood disorders like hemophilia, bleeding disorders, high cholesterol?
High cholesterol runs on my father's side.
Okay.
Again, general to the whole
Okay.
side.
History of breast cancer in your family?
My grandmother, my mother's mother.
Okay.
And all of my great aunts, all of her sisters.
Okay. And about did they develop any
Later, I'd say probably maybe 50s and 60s.
Okay. Any history of other cancer?
My father's mother passed away from intestinal, bowel, and pretty much all intestinal cancer.
Okay. Do you know what age?
I think she was 74.
Okay. Any history of allergies?
My son has allergies.
Okay. Like what type of allergies?
Tree nuts, peanuts, horses, cats, and seasonal.
Oh, okay. Quite a package.
It
You
is.
carry EpiPen with you? And,
We do,
okay,
and
good. And how old is he?
he's 5.
Okay. Gotta always make sure his daycare knows
Mhm.
or school,
Mhm.
friends' houses, that kind of thing. Any history of sickle cell anemia?
No.
What about arthritis?
Nope.
Okay. History of asthma?
My son is asthmatic as well.
Okay. Anyone else in your family?
No.
Okay. History of obesity?
No.
Any alcoholism?
Mhm.
Mental illness, even like anxiety, depression, bipolar disorder, schizophrenia?
No.
Like that in your family? No. Seizure disorders?
Nope.
Kidney disease?
Nope.
Tuberculosis?
Nope.
That's not such a problem these days. Okay. Well, let's see. Let's talk a little bit about your educational history and
Okay.
what you do for a living, that kind of thing. Did you graduate from high school?
I did.
Did you go to college?
I did.
What did you go for?
Doula, a birth assistant.
Like a birth coach, birth
Mhm.
assistant? Okay. Um, what do you do that now for a living?
Actually, with the little ones at home, so I'm a nanny right
Oh,
now for a
okay.
family.
How long have you been doing that?
With the family, I've been with them about a year.
Okay, that's good. And your financial status is okay with doing that?
Mhm.
Um, you get along good with your employers, and
Oh, absolutely.
you probably don't really have coworkers. Get along good with the children.
Yep, absolutely.
Okay, you like your job.
I do. I love my
Good.
job.
Awesome. Do you go to church by chance?
I do.
Okay. What kind of church do you go to?
I'd say I'm a Christian.
Okay. Um, that's good. Good way to socialize for one thing. It's good for the kids, all that. Um, is there anything about your beliefs that would carry over into your health?
Like if I'm sick.
Well, some people have like Jehovah's Witnesses don't believe in getting blood products or.
Oh, nothing like that. I mean, I add prayer into
Okay.
anything I'm sick.
Okay, good. Excellent. Do you routinely get healthcare exams or health exams?
Mhm.
Go to the doctor at least every year?
Yeah.
Okay. Do you get routine dental exams every year as well?
Yes.
Okay. Um, you said you were vegetarian.
Mhm.
Do you eat any animal products?
I eat eggs.
Eggs?
Honey.
So you're not a vegan, you're a vegetarian?
No.
Okay. Do you, can you tell me what you ate today? I know you're having problems with your nausea.
It was a smaller amount today. Had a cup of coffee and I think a banana for breakfast. And
Be careful with the coffee with the IBS.
I try to keep it minimal.
Um, 'Cause some things, you might like. What else do you maybe drink?
Water, juice, soy milk.
Be careful with some of the high sugar juices.
Okay.
Some people have good luck with chamomile tea.
Okay.
That seems to work good for some people. You can put a little bit of honey in it to make sure you're getting enough sugar.
Okay.
Do you have problems with? We'll go more into that here in a minute. Do you exercise regularly?
I do.
What do you do?
Well, I take care of the children, and then I run.
Oh, okay, good. Maybe not when you're not able to eat
Not when
much.
my stomach's flared up. Yeah.
Do you smoke cigarettes or use
No.
tobacco?
No.
Any other substances? Do you
No.
drink alcohol?
No.
Do you use any street drugs, marijuana, cocaine,
No.
meth, amphetamines, nothing
No.
like that? Okay, good. Do you do a self breast exam?
Yes.
How often do you do that?
Monthly.
Good. Do you get a yearly pap smear?
I do.
Excellent. Okay. How is your sleep pattern?
When my IBS is flared up, it's not very good.
Just related to the pain?
Yes.
Okay.
Mm-hmm.
Yeah, maybe the chamomile tea at night can possibly help that
Okay.
too. Do you drive?
I do.
When you do you wear a seatbelt?
Absolutely.
Good. Do you ride a bike by chance?
Occasionally.
When you do, you should wear a helmet. I know we don't like to do that, so you think we look silly, but realistically we should. So all in all, it sounds like you do a pretty good job of maintaining your health. Do you feel like you lead a pretty healthy lifestyle?
Mm-hmm.
Okay. Now there's some questions I have to ask that we just kind of ask everyone, so don't take it like, I'm trying to alienate you or anything like that. But violence is common in today's world, and it can overlap into our homes because violence affects so many people. I routinely ask all these questions of my patients. A few questions, ask a few questions about violence in their lives. So, well, first I'd have to ask, are you married?
Divorced.
Divorced, okay, but are you seeing anybody?
Yes.
Okay. All couples argue now and again, and even the best of couples. So when you and your partner argue, are you ever afraid of him?
No.
Okay. And when you or your partner verbally argue, do you ever think he tries to emotionally hurt or abuse you?
No.
Okay. And does your partner try to control you?
No.
Okay. And does your partner or anyone, or has your partner or anyone ever slapped you, pushed you, hit you, kicked you, or otherwise physically hurt you?
No.
And since you've been pregnant, when you are pregnant, has your partner ever bit you, slapped you, pushed you, hit you, kicked you, or otherwise physically hurt you? Or has your partner ever forced you into sex in which you do not want to participate?
No.
And okay, thanks for letting me ask those. Now, have you had any major stresses in your life? Any major changes? Anything?
Nothing recently.
Nothing recent? Okay. Do you have like a support system?
Mm-hmm.
And how do you normally deal with stress?
Oh, talk about it to people and vent about it, pray about it.
Okay. Running's probably a good outlet.
Running's a good one too.
When you can. Okay. And who would you consider your support system to be?
My family and my boyfriend.
Okay. Good. Do you live in a house or an apartment? Or?
House.
Okay. Is it in a good neighborhood? Or?
It is.
Okay. Do you have any issues with heat, light, or noise?
No.
Heating, lighting, utilities, none of that?
Mm-mm.
No, you have a car, you do okay with transportation, and there's not a big crime rate where you live.
No.
That's not a worry for you. And you don't have any work hazards at the house that you take care of the kids at a house?
Yeah.
Okay. It's just no issues along there.
No.
Okay. We'll kind of just review some of your body systems that might kind of prompt you to, things we might have forgotten to go over. So related to your skin, do you have any rashes, nodules, lesions, infections, allergies, color changes, changes in moles, texture of your skin, changes in your fingernails, the distribution of your hair, tattoos or piercings?
I have a few tattoos.
Okay.
But they're not recent.
Okay. And piercings?
Just my ears.
Just your ears. Okay. I see that you wear glasses. When did you have your last eye exam?
About 6 months ago.
Okay. And do you have any eye pain?
No.
Problems with your pupils?
No.
Blurring of your vision?
No.
Burning?
No.
Swelling? Itching or watering eyes?
It's just itchy and watery if it's seasonal or if it's lack of sleep due to the IBS.
Gotcha. Related to your ears, nose, and sinuses, you have any frequent colds, allergies, nosebleeds, sinus pain, obstruction of the nasal passages, changes in your sense of smell, ear pain, infections, discharge, ringing in the ears, vertigo. Do you know what vertigo is? Okay. Hearing loss?
Nope.
Okay. Related to your mouth, throat, and neck, any pain, difficulty chewing, cold sores, bleeding gums, problems swallowing.
Sometimes with the heartburn.
Okay, with the heartburn. Any hoarseness,
No.
altered taste,
I get a metallic taste in my throat and the back of my mouth when my IBS flares up.
okay. Do you get it like before your IBS?
Towards the beginning and then steadily throughout.
Okay. Swollen lymph nodes like here in your groin, a goiter, swollen groin, okay. Related to your breast and your underarm, any lumps, nipple discharge, pain,
No.
dimpling, tenderness, or swelling of the underarm?
No.
Any related to your, your breathing system, any pain, coughing up blood, unusual, like breathing only through your mouth, anything with a cough, wheezing. And have you ever had a chest X-ray?
Yes.
When was that?
I had one last winter.
Okay. What was that for?
I had the flu, so when going in and they weren't sure what was wrong. So.
Okay. So you've also had influenza as an adult.
Yes.
Okay. Did you have any unusual findings from the chest X-ray?
No.
Okay. Related to your, your heart and your bloodstream, your blood vessel system, have you had any chest pain?
No.
Palpitations? Like, heart beating fast, something like that? Have you ever been told you have a heart murmur?
No.
Any swelling in the legs and feet?
No.
Unusual blood pressure?
No.
Calf pain?
No.
Tiredness, fatigue?
I feel tired and fatigued with the IBS when it flares up.
Just kind of takes a lot out of you.
It does.
Coldness or numbness of the hands and feet?
Yes, it runs in the family.
Okay, make sure you always get your thyroid checked every year too.
Okay.
Varicose veins?
No.
Ulcers of the feet?
No.
Anemia? Tendency towards bleeding?
No.
Bruising?
Sometimes.
Okay. Well, everyone bruises sometimes, but no unusual bruising. Or
They tend to kind of last a long time.
okay, but there might be continue with the multivitamins that make sure you're getting a well-rounded diet, despite the vegetarian.
Okay.
Your blood type, do you know by chance?
I don't.
Okay. I don't know mine either, so it's okay. Really, your stomach, your gastrointestinal system, we talked a little bit, so you get a decreased appetite, and do you lose weight when you have an onset?
Normally.
IBS? Okay. And you kind of steadily gain it back after the fact?
Yeah.
Okay. Any vomiting?
No vomiting.
Okay. And the nausea we talked about. You ever had diarrhea and constipation? Okay.
Both. They alternate.
Okay. And I would say, if you go more than 3 days without having a bowel movement, you're going to want to increase your fluids. Sometimes a person does well with just drinking some warm liquid.
Okay.
Make sure you're getting enough fiber. Do you have constipation and diarrhea even outside of when you're having a flare up though?
Yeah, it just tends to be worse during.
Okay. Just do the best you can. Make sure you're getting enough fluids. That's a big thing.
Okay.
You're constipated. And then with the diarrhea, kind of, we would worry about you losing a lot of your, salts and electrolytes. So normally I'd tell people, try to drink a little bit of chicken broth, something like that. Some people do the sports drinks, but you can't drink chicken broth because it involves chicken. So maybe like vegetable broth, I know they make.
Okay.
And make sure you're drinking some regular water too, doing the best that you can, and then something that's a little bit sweet. And like we talked about the chamomile tea, put a little honey in that, so then you're getting some sugar. Just try to constantly be taking something in, especially if you're that nauseous. It really puts you in a bind because you don't want to end up in the hospital as a result.
Right.
Always feel free to call your doctor.
Okay.
Have you ever had any? Do you have problems with gas with IBS? Is that common? Do Do you take anything for it?
Over-the-counter Grass.
Okay, like Myocon.
Mhm.
Okay. Um, and we talked about the heartburn. Do you take anything for the heartburn?
Besides the prescription, sometimes I take like Tums or
Okay. Okay. And what's the frequency of your bowel movements regularly?
Depends on if it's constipation or diarrhea that week.
So you kind of just go.
It goes back and
Well,
forth.
like I said, more than 3 days, you go without a bowel movement. Try to let your doctor know.
Okay.
You ever have bloody or tarry stools?
No.
Have problems with hemorrhoids?
No.
Okay. Do you ever use a laxative?
No.
No? Okay. Related to your genital urinary system, you ever have any pain, burning, or frequency?
No.
Increased urination at night?
Mm-mm.
Feeling like you can't completely empty your bladder?
No.
Changes in the color or odor of the
No.
urine? Genital discharge?
Nope.
Infections, lesions, pain?
No.
Anything like that? Do you still you menstruate?
Mm-hmm.
What does your normal cycle last?
About 4 days.
Okay. Yeah. Do you have any problems with PMS?
It can flare up the IBS.
Okay. So can it bring on an episode of IBS?
It can.
Okay.
Mm-hmm.
Have you ever taken birth control as a means to help with the
I
IBS?
have tried that.
Is that not did not seem to work for you?
I think when I first started taking it when I was younger, it did. I don't think if I'm older, I don't think that it is quite as effective now.
Okay. As far as your musculoskeletal system, do you have any pain, swelling, or stiffness in your joints?
No.
Any problems with your muscles, bones, deformities, limited range of motion
No.
in your body, weakness or gait, walking problems with
No.
walking? Okay. Neurological or endocrine system, any fainting,
No.
dizziness, seizures, paresthesia, which is like unusual sensations, kind of like your foot falls asleep can be an example.
No.
Pins and needles, nothing like that.
Mm-mm.
Any problems with paralysis?
No.
Memory changes?
No.
Headaches?
No.
Mood changes?
Sometimes I feel kind of depressed with the IBS. Just
Okay. That can be normal, but is it something that lasts beyond the episode?
no.
Or,
No.
okay. We all get depressed sometimes. But if there's ever anything that doesn't really go away or it's starting to affect you, don't be afraid to talk to someone about it.
Okay.
Any hallucinations?
No.
Any increased thirst?
No.
Increased urination? Tremors?
No.
Changes in temperature? Sensitivity, like you're sensitive to hot or sensitive to cold?
When the IBS is flared
Okay.
up.
Make sure you always get your thyroid checked.
Okay.
I think I've said that already. Voice changes?
No.
Changes in your shoe size or glove size?
No.
If you wear gloves by chance.
No.
Excessive sweating?
No.
Okay, well, and that's about it. And so we have Shannon is a 32-year-old female who has come in for a exacerbation of her irritable bowel syndrome. She is having pain at a 6 out of 10 that she describes as aching and cramping with occasional sharp pains. She rates it at a 6 out of 10, and eating makes it worse, and anything to the touch of her abdomen makes it worse. Her mother also has irritable bowel syndrome. They both had it since 2002. She's having difficulty with her, being physically active, doing their normal everyday physical things related to the severity of the IBS flare-up and the pain associated with it. She also has some heartburn that's quite severe and constant. She's had 3 colonoscopies in the past, upper and lower GIs actually, and she also has some lactose intolerance related to the irritable bowel. She takes a multivitamin, a B12 vitamin, calcium carbonate, and Prilosec. And I advise her to take a vitamin B complex instead of just the B12. She has taken Ultram and Bentyl, promethazine and Zofran, and birth control in the past related to her IBS, all of which she found to be unsuccessful. She's currently working as a nanny, and it is starting to affect her job, her ability to do the job at this time related to how severe the pain